Yeah.
Okay, so we can get started whenever you guys are ready. Yeah.
Good morning, everybody. My name is Dr. Alia Khan. I'm a clinical professor of medicine at McMaster University, and I'm a board member of OSIM, Union of Medical Care Delivery in Canada. OSIM is an international medical relief organization, and this provides medical relief globally on the ground. Today, we have presentations from a number of physicians representing other medical organizations as well. And we are collectively demanding 4 requests from our government and the international community as representatives of more than 3,000 physicians. Is the audiovisual good? Actually, should we redo it?
It
Okay,
wasn't on. You want to start?
let's
Yeah?
redo it again.
Okay, try.
Okay, should we redo it or we're good? Okay. Our 4 demands are, number 1, we as physicians are calling for an immediate ceasefire with protection of all children and civilians in Gaza. Number 2, we demand enforcement of the Geneva Conventions in conflict zones with protection from hospitals, for hospitals, healthcare workers, enabling them to provide life-saving medical care. Hospitals and medical staff have unfortunately been specifically targeted in this carpet bombing assault on Gaza, and this must stop immediately. Number 3, we ask that the Rafah border be immediately opened, allowing evacuation of the wounded and the children and those in immediate need for medical care. Number 4, we urgently need a humanitarian corridor with delivery of food, water, and fuel. We're seeing hospitals being non-functional because of lack of energy. And there is no electricity. They were working only on generators, and now the fuel has basically been run out. The attack on Israel by Hamas, followed by the Israeli carpet bombing of Gaza, has killed more than 1,400 Israelis, mainly civilians. More than 9,000 Palestinians, mainly children and women, have been killed, of which 3,761 are children. There are more than 1,150 missing children. OSIM has written a letter to the editor of Lancet, and this has been signed by more than 2,500 Canadian physicians, and this is included in the press release materials with other letters by supporting medical organizations of this press conference. We condemn the killing of all civilians, regardless of race, ethnicity, and especially the killing of children and women. We also condemn the barbaric bombing of hospitals and schools. Israel ordered 20 hospitals to evacuate before bombing the hospitals, killing thousands of people, mostly children and women. Physicians and medical staff have refused to leave the hospitals and have refused to abandon their patients, preferring to be killed with their patients under their care. These physicians and nurses are our heroes, and we stand in solidarity with them. Bombing hospitals and schools is prohibited under international law. It is inhumane, it is barbaric, it is savage. And we demand that rules-based international law be implemented immediately. Under international law, an occupying force is required to protect its civilians. The right to self-defense does not give the right to commit genocide in Gaza. We demand an immediate ceasefire with protection of all children and civilians. No country is above international law, and carpet bombing of children is not tolerated. These war crimes must be immediately stopped. Preventing access to food, water, and fuel to civilians and hospitals is resulting in deaths of thousands of innocent children, women, and civilians. We demand an end to the blockade of water, food, and fuel to Gaza. We need a humanitarian corridor with evacuation of the critically wounded civilians and delivery of food, water, and medical aid. And I note that in World War II, before the bombing in England, the children were evacuated, and no such measures have been taken in Gaza. In fact, it appears that the children are the targets of these terroristic, savage, inhumane, barbaric bombing campaigns. Their small bodies are being shattered, and their lives are being destroyed as the world's mightiest armies drop bombs on their homes, their hospitals, and their schools. This indiscriminate bombing is inhumane and is condemned. Our next speaker is Dr. Anas Al-Qasim. Dr. Al-Qasim is a trauma and bariatric surgeon. He is also the chief of surgery at Norfolk Hospital in Simcoe, and he has been the founding vice chair of OSAM and has experience in war zones. Dr. Anas Al-Qasim.
Thank you, Dr. Khan. Ladies and gentlemen, we're convening today amidst a humanitarian crisis of profound severity. In Gaza, the statistics are more than just numbers. They represent a harrowing reality. Over 400 children are subjected to fatal injuries on a daily basis, as documented by the healthcare authorities in Gaza. This disturbing figure is a stark reminder of our collective responsibility today towards humanity. The World Health Organization has reported 34 instances of aggression targeting healthcare facilities, including 21 hospitals in Gaza. Subsequently, 12 out of 35 hospitals in Gaza are now non-operational. Over the past weekend, the vicinities of prominent medical facilities, including Al-Shifa Hospital, Al-Quds Hospital in Gaza City, Indonesian Hospital in northern Gaza, have suffered significant bombardments as confirmed by OCHA, the UN Office for the Coordination of Humanitarian Affairs. Dr. Alo from Gaza Shifa Hospital, he's an internist, has recounted the distressing choices necessitated by the scarcity of medical resources, such as the heart-wrenching decision not to resuscitate a patient because of lack of ventilators. The doctors in Gaza hospitals refused the evacuation orders and decided to continue to serve at the hospitals, drawing parallels to the dire condition I myself witnessed in the Syrian war in Aleppo city, where indiscriminate aerial bombardment took place, killing thousands of civilians. Dr. Alo's sentiments echo a difficult reality. Medical professionals are trained to save lives, not to make excruciating decisions on who should live and who should not. These are choices no healthcare provider should ever have to make. At Shifa Hospital, an overwhelming influx of patients compounded by a lack of medical supplies and drugs due to the ongoing closure of Rafah crossing has led to surgeries being done in the hallways and without anesthesia. The hospital documented receiving more than 100 severely wounded children on a daily basis, straining the already limited PEDS beds and ventilators in the hospital. As a trauma surgeon, I feel the deep pain of needing to perform surgeries, including amputations of limbs on children without anesthesia. Unfortunately, this is happening in Gaza today while we're all watching. Additionally, the UN Nation Population Fund has reported that emergency C-sections have been performed without anesthesia amid the shortages of medical supplies and drugs. Tragically, the doctors are sometimes left delivering premature infants of mothers who could not be saved. In closing, this press conference serves not only to disseminate information, but to call upon the international community and the Canadian government for urgent assistance and intervention, the protection of healthcare facilities, and the right to medical care by every human being must be upheld. It is our collective responsibility to respond to this crisis with the urgency it demands. Thank you.
Thank you, Dr. Anas Al-Qasim. I'm now going to ask Dr. Ben Thompson to give us his perspective. He is a nephrologist at the Mackenzie Health Center, and he has volunteered in Gaza and the West Bank since 2013. And he has also been involved in teaching physicians in Gaza. Thank you, Dr. Ben Thompson, for speaking today.
Thank you so much. As of this morning, Gaza's healthcare system has reached catastrophe. I spoke with two of my physician friends this morning who work at Gaza City's largest hospital, Shifa Hospital. Intensive care unit beds have been rationed. This means that unstable patients are dying in the hallways of the hospital because there is nowhere else to put them. Dialysis sessions have also been rationed. Most patients with kidney disease who need dialysis need it at least 3 times a week. Now, most dialysis patients in Gaza are receiving only 1 or 2 treatments a week, which dramatically increases their risk of death. Last week, in the Shifa Hospital in Gaza City, doctors agreed they would no longer resuscitate any patient who had a cardiac arrest because there was nowhere to put them if the resuscitation was successful. Instead, those patients simply die. Yesterday, Gaza's only cancer treatment hospital shut down because there was no more fuel to run the backup generators. Now, nobody in Gaza is getting cancer treatment. One of the main pediatric units in Gaza, called the Al Jura Children's Hospital in eastern Gaza, was hit with white phosphorus, a banned chemical weapon that causes severe burns. This hospital has been evacuated and is non-functional. Also yesterday, the Al Halal Hospital in Gaza City was bombed. This hospital had absorbed Shifa Hospital's maternity ward in an effort to expand capacity for critically injured patients. Some children have been moved to the Rantisi Hospital in Gaza City, and as of this morning, the Ministry of Health reports that bombings have continued and patients within the hospital they're making the best efforts possible to move them. As of this morning, 16 of the 35 hospitals in Gaza with inpatient capabilities are completely non-functional. Shifa, an Indonesian hospital, as of this morning, were reported to be hours away from being non-functional due to the lack of fuel and electricity. An hour before I stood here, the Ministry of Health in Gaza has reported the Indonesian hospital has run out of fuel, and so therefore is non-functional. Fuel is desperately needed by hospitals now to operate life-saving equipment. According to the United Nations Emergency Relief Coordinator, it has been banned by Israeli authorities. She also notes, the coordinator, that trucks entering Gaza with humanitarian aid are requiring what she says painstaking negotiations to enter and are nowhere near enough. Ongoing fighting in the north means that about 300,000 internally displaced people can't get any humanitarian aid. They have no clean water, no food, no electricity, no safe housing. Inside Gaza City, raw sewage is overflowing into the streets, and there are already reports of worsening diarrheal illnesses. The United Nations Relief and Works Agency states that most shelters are more than 4 times their maximal capacity. This overcrowding significantly increases the risk of infectious diseases, such as tuberculosis. In short, this is a disaster. Only with an immediate end to the hostilities, rapid and unimpeded access to humanitarian aid can people in Gaza start to enjoy the life that they deserve. I've been to Gaza many times. I've worked as a medic. I've cared for peaceful protesters who were shot with live ammunition. I've worked in the emergency room after bombings. I've held a dead, burned baby in my hands while that child's father screamed at me to help. That was horrible. What's happening in Gaza right now is worse. It is on a scale that I have never seen. We must immediately restore humanity. And to do this, we must allow unimpeded and rapid humanitarian aid and an immediate ceasefire. Thank you.
Thank you, Dr. Ben Thompson. Our next speaker is Dr. Fawzia Alvi. Dr. Fawzia Alvi is a family physician in Calgary and founder of Humanity Auxilium, which serves oppressed and underprivileged communities globally. She has physicians on the ground in hospitals in Gaza, and we will ask her to give her perspective.
Thank you, Dr. Khan. Can you hear me?
Yes.
Can you hear me, Dr. Khan?
Yes, yes.
Okay. Yeah, thank you very much for inviting me to speak. I was listening to my colleagues and I echo what they were saying. We have our teams on the ground now in Shifa Hospital and Indonesian Hospital. Basically, they were telling me the same things, same stories. And also, as Dr. Qasim was saying that, you know, the small children's getting amputated without anesthesia, pregnant women getting operated without pain medication, without any anesthesia. Can you imagine the trauma of the patients as well as for the healthcare professionals? So I'm a medical doctor for the last 25, 30 years. I'm a humanitarian working all over the world with oppressed and refugees, but I have not seen anything like that in my life. I'm not very concerned about the politics, what's going on behind, but rather than intense human cost, what's going on and how we can directly help. So as Dr. Thompson was saying that some stats about the deaths that we have it in the last few weeks, according to one report, one child is dying every hour in Gaza. So those innocent children, they are like my children and your children who have nothing to do with the Gaza, who have nothing to do with the politics. They did not choose to be born in Gaza. So they are humans. They have dreams and ambitions like my children. They aspire to be doctors, engineers, like our children. Dialysis patients, my colleagues were telling me that they're suffering. They're not able to get dialysis. Cancer patients are not able to get chemotherapy. So Gaza has 2.3 million people, a much larger population than Calgary, the size where I live. People are dying due to the lack of medical supplies, lots of infections due to the lack of clean water. And my team were telling me about these evacuation orders that people of Gaza were told to evacuate from north to south. You cannot transport patients. You cannot transport people who are in ICU, who are kids who are on ventilators. Medical situation right now is something out of biblical apocalypse. There are bombs falling out of the sky on such a constant basis that now people are having to dig out the bodies of their loved ones with their bare hands. Electricity and internet have gone off and foods have been blocked. So Gaza has quite literally been forcibly isolated from the rest of the world. So when I have in touch, I keep on losing the contact communications with my teams on the ground. And sometimes when I'm talking to them, literally we are talking in between the airstrikes. The main hospital that they are operating right now is projected to run off the fuel today. And the doctors are working through the constant risk and reminder of the airstrikes and white phosphorus attacks. At the moment, our teams are distributing food rations in the ground. They are helping people. Also, half of them, almost they have lost their families. So I I immediately asked our government to call for ceasefire and allow the humanitarian corridor open so we can go and help our colleagues.
Thank you very much, Dr. Fawzia Alvi. I would like to just remind everybody that in every war since World War II, Canada has served as a global humanitarian leader. And we ask that Canada once again be a defender of international human rights and international rule-based law. Now is the time to take action and demand an urgent ceasefire, evacuation of children and the wounded, an opening of a humanitarian corridor, an immediate delivery of food, water, and fuel to Gaza. We pray that all people be able to live with peace and dignity in Israel and Palestine, and an end to the barbaric bombing of Gaza. Ladies and gentlemen, if we have to stand here today and say that bombing children is wrong, we have collectively lost our humanity. We are requesting a meeting with the Prime Minister of Canada and request that our demands be addressed urgently. Thank you. We are happy to answer questions for the media and for attendees present today. Thank you.
Can I ask, can you touch on, you spoke about your colleagues in Gaza, how they're staying by the victims and anybody else who needs this healthcare. Can you touch on the dedication of these healthcare professionals who, in some cases, some of them might have lost family members who don't want to leave their patients behind?
Yes, absolutely. I'm going to ask Dr. Anas Al-Hassem and Dr. Ben Thompson to describe their personal experiences in these areas.
Thank you, Dr. Khan. I think Dr. Thompson has been in Gaza many times and still have a lot of connections with Geneva hospitals and other hospitals. But I can tell you, we have been trying to help as our Union of Medical Care Relief Organization, Gaza hospitals before the war started, before the 7th of October. And they are in dire need for equipment, medical supplies, and it takes us months and months to be able to get it from Israel to cross to Gaza, because Gaza has been under siege now for more than 16 years. So the situation even before that was tough, but unfortunately, I've been talking with many surgeons on the ground, and I lost the connection in the last few days. I don't have an update about how they're doing. One of them is Dr. Marwan, is one of the top surgeons in Al-Shifa Hospital. I hope they're fine, but I know they're working day and night, and I know they are sleeping in the hospitals. They can't even go outside the hospital. It's very unsafe to go in any kind of, streets under the bombardments. So I pray for their safety, but I can't really say if they are safe at this moment or not. Dr. Thompson.
Yes.
Thank you. Yeah, I mean, I think it's safe to say no one is safe in Gaza. It doesn't matter if you're in a shelter, if you're in a school, if you're in your home, in your hospital, there is nowhere that is safe right now in Gaza. You mentioned Dr. Allo, who is a good friend of mine, has actually been interviewed quite frequently. The first interview he did, his house was bombed during the interview. The windows and doors blew out of his home. He managed to collect his children, collect his father that he lives with, come back to the phone, and finish the interview. The next day, he went to work. I wish I could say this was a rare story. This is the story of every physician who's working in Gaza. Everyone has lost friends. Everyone has lost family members. Another example, in 2019, I was a field medic during the Great March of Return protests, which were largely peaceful protests throughout Gaza for the purposes of trying to grant Palestinian people the right to return as dictated in international law. On one of the days I was a medic, I was essentially going, running, picking people up who were shot, bringing them to the trauma stabilization point where they would subsequently get higher levels of care. Many of the people who were shot were actually healthcare providers. And they knew that was a risk to providing care to their own people. And they still came every single week because they knew that without that, their people would just die. These are committed physicians, committed healthcare workers who are coming to work knowing that there's risks and still so committed, they're still coming and still doing it because their patient care is so important.
Thank you. Any other questions or comments?
Have you had any responses from the federal government at all? And in the future, I know one of the last things you said is you want a meeting with the Prime Minister. Have you sent over your demands to the federal government?
Yes, we are sending our demands. We have sent a copy of the letter with more than 2,500 Canadian signatories who are all physicians demanding that these 4 points that I've presented be addressed. And this is being sent to all MPs across Canada. Thank you.
You want to reply?
Okay,
Thank you very much.
thank you. Thank you for your attention.
Thank you.